vaccine that has gone through all the rigorous process that you normally take before you certify vaccine.
Your cap.
We agree, we allow for skepticism, but the health system is meant to educate people. That is why we are here. They're starting the vaccination right here at the National Hospital. They're giving doctors who work in the isolation center, whom we all need. We won't risk those health workers on a vaccine that we are not sure of. Our CMD is here, is taking the vaccine. The president of the country himself is going to take the vaccine. We should all be aware that vaccine is a safe and effective way of preventing communicable diseases. And so, for safety, we would say the vaccine is very safe, and we would encourage people to use it. As many patients as we have encounters, we try to educate them, because of course they are conspiracy theories, but we have to debunk them as healthcare workers, and everybody will follow suit. We need herd immunity. At least 70% of the nation needs to be vaccinated. Corona is no joke.
Vaccination campaign we kick off today will be in 4 phases, and we align with the planned arrival of vaccines in batches. Each phase targets a specific segment of our eligible population to ensure equity in vaccine deployment. The defined frontline healthcare workers are prioritized globally for vaccinations against COVID-19 due to their higher exposure to the risk of infection with COVID-19 in the course of duty. For our own sake, since any one of them absent due to illness means again a depletion in their ranks and can forebode staff shortage. It therefore makes sense to cater first to those who cater to us. The next prioritized group are those who, if they become infected, are at higher risk of severe disease. These are the elderly and the vulnerable, as defined by presenting with pre-existing conditions like obesity, diabetes, chronic kidney, respiratory, and heart disease, and cardiovascular diseases and other medical conditions as identified by their doctors.
For us in Nigeria, and indeed nations of the world, the lessons to be drawn from this lack of discrimination by the virus are numerous. They include the fact that we must approach the vaccines phase with unity of purpose. 2, we must understand that nobody is safe until everyone is vaccinated. And 3, we must recognize that vaccine hesitancy will impact negatively on our lives and those of our loved ones if allowed to foster. 4, we must demonstrate at all times that this is a war of MPIs plus vaccines for the survival of everyone. And 5, we must believe our government on the safety and efficacy of the vaccines brought to Nigeria. And lastly, we must support the planned and systematic rollout of the vaccines and mobilize our citizens as we move into the states.
We have all concluded preparedness through the cold chain assessment and I want to assure you that we have capacity to store, distribute, and make sure that these vaccines are well kept. And I want to also mention that within the FCT, for instance, we already have designated 65 vaccination points in the 6 area councils for the first phase of the implementation.